So today is World AIDS Awareness Day, and I figured we should pay tribute to that. Now we all know that autoimmune deficiency syndrome is a real hot topic in today and has been for the past few decades. So there's a million things we could talk about, be it pathophysiology or pharmacology or epidemiology. But today I'd like to concentrate on a current event. Now I'm sure many of you have heard about this farm bro guy, and I'll refrain from using his real name, and I'll refrain from using some inappropriate language to describe him. But this particular idiot decided to purchase a very important drug for immunocompromised patients. It's called Daraprim. Now this guy bought the rights to this drug and then raised the price from its original $13 and some change to $700 a pill. Now, whether this is ethical or not is clearly obvious, but aside from him ruining his career and his reputation, what the media tended to do with this situation is they made it sound as though he bought the right to the AIDS drug, and that's a misnomer. Daraprim is not exactly the AIDS drug where it cures AIDS per se, but it is a drug that immunocompromised patients, such as people with autoimmune deficiency syndrome, are required to take in order to prevent normal infections that we are able to fight off, that they need these drugs to be able to assist in that. So looking at this diagram, we can see there are three organisms here. Now these three organisms are typically present, and our bodies are able to fight off these infections purely because we have a high CD4 count. As the AIDS syndrome continues to worsen, their CD4 counts lower, and so they are more susceptible to certain bacteria or viruses or fungi, etc., different organisms. So some of the key ones that are very distinct to AIDS patients are Pneumocystis jirovecii at less than 200 CD4 count, Toxoplasma gondii at less than 100 CD4 count, and Mycobacterium avium at less than 50 CD4 count. Now, Toxoplasma gondii is an organism that is spread from cats, felines, also from cat feces or litter boxes from cats. It is also a teratogen. So women who are pregnant are told to either get rid of their cats or definitely stay away from cleaning the litter boxes, and same with immunocompromised patients. The feces that these cats have carries the Toxoplasma gondii, and pregnant women as well as immunocompromised patients are more likely to get infected by this organism. Now, Daraprim, this drug, typically acts to eradicate Toxoplasma gondii from our system. And how does it do it? It blocks this pathway of DNA synthesis by blocking dihydrofolic acid to turning into tetrahydrofolic acid. So it blocks this enzyme right here and prevents purine and DNA synthesis as well. So as we can see in this diagram, this immunocompromised patient is ill and has no idea that his little feline friend is causing his illness. And because of Farm Bro, this drug Daraprim was not affordable and feasible for him to continue his normally scheduled treatment. Luckily enough, because of some other farm companies that have decided to take it upon themselves to make this Farm Bro guy look like an absolute idiot, they were able to synthesize an analog of this particular drug. It works in the exact same spot to prevent DNA and folate synthesis, and they sold it at a whopping $1. So there you go, Farm Bro. And let's remember, it's World AIDS Awareness Day.